Alright, I'm approaching the scene. Is there any danger as I
No.
approach?
No. Guys
What
are
do
on
I
scene.
see? Yeah.
Guys are on scene.
Yeah, what do I see as I approach?
Okay, you see a man on the ground flailing his arms around, right? He's a bit ramped up, a bit agitated,
Okay.
flailing his arms around.
Okay, what's his colour? Can you see that?
Okay, his colour is, well, it's okay.
Hey guys, I'm
Hey.
Rachael.
G'day,
Hey
Rach.
Rachel. What's going on?
We've got Brian here. We've spoken to his wife.
Yeah.
He's sort of collapsed and just been really agitated. We haven't been able to get any obs yet.
Okay, no complaint prior to this collapse that we know of?
Our wife said
No.
he's had hypertension and depression, but that's it. Like, yeah.
Okay, so I'm just going to do a quick primary survey, guys. What I'm going to do is looking at my patient. Mate, can you hear me?
No,
No
Keep
response to
going,
that?
keep going. Okay.
Trap squeeze?
that, he opens his eyes,
Yep,
gets more agitated,
yep,
right? And he's inappropriate words.
yep. Any motor response?
Yeah, he'll go straight at you, right?
Yep, yep,
The more
localising.
you touch him, the more ramped up he gets, right? So
Okay.
he's flailing his arms around, he's
Yeah.
moving a bit.
Alright, so he's got a patent airway, assessing his breathing
Okay, he's breathing rapidly,
rapidly and feeling for a radial pulse.
and you can't because his arms are flailing around.
Can I feel a carotid?
He gets really ramped up, moves his head all around.
Yep.
Yeah.
Alright guys, can we do the best we can to try and get a BSL, just
Yeah.
to rule that out? I'm just going to talk to, where's the wife?
Here, me.
Okay. With your husband, what medical history does he have?
Icky, like that other guy said, he's
Yeah.
got depression and something wrong with him, but then he's got high blood pressure.
Okay, have you got medications around at all?
I'll go and look for them in the kitchen. He usually keeps them up in the kitchen.
Okay, and what did you see happen today? Just suddenly collapsed and became
yeah,
agitated?
he's just been unwell the last couple of days, and he's just funny. He's just weird. I've
Did
never
he
seen him
complain
like
of
weird.
any headaches?
No,
chest pain, shortness of breath?
Nothing like that. He just,
Okay.
and then he was a bit funny this morning. And then he lay down on the ground, and started doing all this shit that he's
Okay.
doing now. These bloody, and I called you because
Alright.
I can't control. I don't know what's going on.
Is he allergic to anything?
He's allergic to a thing called Keflex, I think.
Keflex? And okay, we'll grab those meds if you can grab the packets. Alright.
Yeah,
How
I'll-
did we
I'll
manage
go
to
and
get a
find it.
BSL?
Yeah, I got a
What
BSL,
was it?
7.1.
7.1? Okay, good. Alright, let's try our best to just try and get some dots on. Okay, I know it's going to be really difficult. We can go down the pathway of Draperidot if we need to, but I just want to get a bit more of a history of what's going on. Just looking at my patient, is he exposed like he is with his shirt off?
You get the picture that you can't really get that close to him because his arms are bumping you or
Yeah,
throwing
okay.
his arms around.
But
Right?
if I look externally, I can't see any
No
sign of
chance of
trauma.
getting those dots on.
I can't see any sign of trauma.
No sign of trauma.
Were his eyes open? Could I see his pupil size?
Yeah.
Yeah.
Size
How were
4
they?
and
Size 4? Alright, have we got those medications back?
No, she's still looking.
Okay. Just look at my patient. What does he weigh approximately?
He weighs about 90 kilos.
Okay, is he chest-wise not big chested, neck
No.
looks normal,
No,
not
he
big
looks
fat
fairly
neck?
normal.
Beard?
So ears?
Has he got a beard?
Beard, no beard.
No, so looking at airway-wise, I'm seeing teeth.
Yeah.
Cool,
Yeah.
alright. Can we get some airway stuff set up just in
Yeah.
case? Just get an OP out, a
Okay,
bit
so
of
he's
down
still
out,
flailing
and let's
around.
try and just get the oxygen out, mask out, alright? At the moment,
He's
we can't really
inappropriate
manage him
words,
at
he's
all.
still talking, he's talking garbage, he's flailing his
Yeah.
arms around.
So at the moment, we can't assess him to know what's going on. So I'm thinking at this point, until we get these meds to see what we're dealing with, we're probably going to have to go down a sedation pathway to actually be able to manage this patient effectively, okay, for the safety of him and for us.
Yes.
Alright, I'm just going to give a sit rep, Alpha 337.
Yeah, 3-7 go.
337, can we get a second crew here, please, code 1 for assistance, we have an agitated patient.
We'll attempt to do so.
Yep, great. Can I get you to set up some stuff for IV access when we get
Yep.
a chance and to draw up some Draperidol? You said he's 68 years old.
He is.
Yeah. So 5 milligrams of iron Draperidol. We'll get that drawn up as well. So we've managed to get a BSL.
Yeah.
Can't see any signs of trauma. His pupils are equal. Obviously, guys, differential wise, is there something, is there a head injury going on, like I believe CBA? Is there something endocrine or metabolic going on? Is there something tox going on? And we really need to get an ECG. So we've got to get
Yeah.
some stuff prepared so that we can begin to manage this patient appropriately, okay?
Sounds good.
And we'll make sure we've got all our monitoring ready to go when we can use it. Are those
Okay.
medications back yet?
No, she can't find them. She's still working,
Okay.
trying to
Does
find
she know
them.
the names of them?
She says there's one antidepressant one,
What?
and there's one,
know the name
and
of
he's
that
on
one?
aspirin as well. That's what he is.
Aspirin. Does she know the name of the antidepressant?
No, she'll have to find the packet for you.
When I touch him, do you feel hot to touch at all?
Okay, no.
No? Okay. And I couldn't really get a
Yes, he is a little bit warm.
He is a little bit warm. Okay.
Did you get a BSL
All
by
right. We
the way?
did.
Yeah.
Yeah,
Seven?
BSL, you were actually able to achieve that, believe it
Yeah.
or not, and you got 7.2.
Can we try and get a temperature if we can? We'll just see
Yeah,
if we
sure
can.
thing.
Right, so we're just going to have everything set up. We want to make sure everything's maintaining. He's maintaining his own airway. We'll get our suction
10
as
milligrams.
well. I'm just going to open this up in case I need it.
Parallel, 2008.
Right, great. Okay. Can you let us take that temperature if we hold his head?
Yeah, you
What's
just
temperature?
scored it, 37.9.
37.9. What's he been unwell with for the last few days?
Oh, I don't know. I think he's just got. I think it's his depression that's made him unwell. It's just.
Has he voiced any threats like he wants to hurt himself at all?
Yeah, he has a little bit.
Has he ever done that before?
No. This is what concerns me.
So he's never done that
Crazy.
before, but he has expressed thoughts.
Yeah.
Do you think there's any chance he could have overdosed on his antidepressants?
Oh, I guess there's a chance. Yeah.
Do you want to maybe check the bin to see if there's any empty packets?
Yeah.
That'd be great. All right, guys. So with that history, I'm concerned.
Rachel,
there is-
there's a
what
bit
have we
here.
got? Yep. All right. Okay. So he's 68 years old. So we're going to
Still
give
flailing
5
around,
milligrams
still agitated.
of iamdroperidol.
Yep.
Okay. All right. We need to get control of this guy really quickly with this MDAP. Okay. So we're just going to give it. Now, really quickly, we're going to make sure that we're nice and safe. We're going to do that into the thigh to get
Yep.
better
Can you just
access.
hold that
Yeah,
one
Shannon. I'm going to get you, I'm going to stay on the airway for now, okay?
Yeah.
I'm going to get you as soon as we are able to get monitoring on.
Sure thing.
Our main concerns with this, guys, is respiratory depression or loss of airway reflexes.
Yep.
So we've got everything here ready to go. We've done an airway assessment. We've got an idea of our comorbidities. He is older, so he's a higher risk, but we need to gain control. So if
Okay.
everyone's happy with the plan, all right, I'm going to hold arms down. We can get 5 milligrams of droperidol
Okay,
and
that's
mark the
in.
time of that, okay? Alright, so
That's
when I
all
look at
6.
this box, does it say how many tablets and what the dose?
Yeah, the box is empty and
Yeah.
it was scripted 2 days ago.
Yep, and what sort of volume is in there? What?
Lots.
Okay. If I'm looking at it and calculating,
Toxic
what I'm
dose.
trying to do is look at is it 10, 20 or 30 mil per kilo? Knowing that greater 10 mil per kilo I'm going to be symptomatic and greater than 30 mil per kilo is a lethal dose. So that's what I'm looking at there.
20 milligrams.
Okay, great. So guys, our plan is as soon as we are able to, we need to get a 12 lead as the first priority.
Okay.
Get a blood pressure on and we'll interval that to be every 5 minutes and
Yeah.
get an SpO2. And then we'll get IV access as a priority as well, okay? All right.
Yeah.
So just watching the patient, trying to keep hands off as much as we can until he calms down, but making sure he's maintaining his own airway. We've got suction ready. Are we able to get him on his
Okay.
side or is he
Let's-
still agitated?
Let's walk time forward 5 minutes.
Okay,
Right, and he's noticeably more settled.
great. Can we get some OBS? Have we got an SpO2 coming back?
Okay, SpO2 unreliably reading but bouncing around about 88%.
Poor cleft wave though.
Or cleft wave.
Okay, right.
Not really that
Is
good.
he able to tolerate oxygen if I put on the non-rebreather at 15 litres?
Okay, he tolerates that.
Great, alright,
With a
so I'm
little
just
bit
going
of
to do it.
encouragement from you.
Yeah, great.
Yeah.
You're doing really well, mate, okay. So guys, I'm going to do that. I'm going to do a primary survey while you do all of that. Okay, so just do another assessment. Mate, can you open your eyes up for me?
No, he doesn't do that.
Painful stimulus.
Eyes open to painful stimuli.
Still groaning.
Still groaning inappropriate words.
Localising.
He is localised.
So he's a GCS 9 but more settled.
Yes.
Still maintaining his own airway. I can't
Yes,
see any
he
vomit
is.
or anything. Respirator still.
Respirate is, now you have a chance of counting up, 30 a minute.
30 per minute. And feeling carotid pulse.
Yes, he has that.
James, have you got a radial pulse down there?
James says really faint, mate. if
Yep,
it's
and what
hearable.
rate?
And it's
Fast.
fast.
Okay, great. And just going to have a look at pupils while we're here.
Pupils are size 5.
Yeah. Looking at his chest, there's nice equal rise and fall. Good chest excursion.
Yeah,
Having a feel of his tummy.
yeah.
And
Feeling
that's-
around though arcs him up a bit.
Yeah,
He doesn't
okay.
like that. He doesn't
And
like
limbs
that
wise,
touching
can't see
you.
any sign of trauma. Alright. So, have we got a blood pressure back?
All right, blood
Let you
pressure
get
80
access.
on 40.
80 on 40. Alright.
Needle
what's
goes
your,
in.
What's your name?
Joan.
Joan, can I get you to get a chair and pop his legs up on the chair for me, please?
Yeah.
Thank you. All right, 80 on 40. SBO is coming up. Paul Plethway.
So we've got the 12 lead on.
Yep, so getting a 12 lead printout as well.
Very good pay.
Okay, 12 lead
Okay,
ECG,
perfect.
12 lead ECG, and yeah, that's the right way up there.
Okay, great. Okay, guys, so we've got a terminal R wave and AVR. And in the blurriness, it looks like it's wide. All right on 0.12. All right, so have we got access?
Yeah.
It's a little bit
Great.
wider than 0.12.
Yeah, cool. They're just struggling with the blurriness without
Yeah.
glasses. Can I get you to get a bag of fluids for me?
Yep.
So probably we've got all our other vital signs we've got. Shannon, I'm
Yeah,
going to
great.
get you to drop some sodium bicarbonate for me. Have you done that before?
Yes, I have.
Awesome. So we'll get a 50 ml syringe. And we'll drop 2 lots of sodium bicarbonate to have 100 mils.
Sounds good.
Okay. So airway wise, still tolerating as it is.
Yes, it is.
Yeah, great. Okay, so we've got OP out ready to go. And at this point in time, it's still a GCS of 9. So everything there. Alright, so what I am going to do, guys, if you're happy, James, I've got you on fluids.
Sodium chloride, July 19.
July 19. Let's start giving that. I'm just going to have a quick listen to his chest.
Transfer the jars to this one, please.
Yep, certainly. Sodium bicarbonate, for 100, and expires August 2020.
Well, thank you.
Chest is clear.
Chest
Chest
is
is clear.
clear. Okay, great. And no signs of obvious pedal edema or anything like
No.
that? No history of cardiac or renal failure?
No.
Great, and he's not on Lexis. So
Can you hold
Fluids
this for me,
wise?
Joan?
let's open that fluids up. We've got our leg sprays. We're going to do our sodium bicarbonate. I'm just going to quickly set up some stuff in case our GCS drops,
Yep.
and we'll need to intubate the patient. So we'll have all of that ready to go as well.
Lovely.
We're going to give 100 mils of sodium bic at this point. So if we can mark the time of that. So we'll give 2 lots of 50. Make sure it's drug checked.
Yeah, have some drug check with James. So there's the first 50 at 9:10.
Great. Great. We might also draw up, if you've got time, Shannon,
Yeah.
5 and 5 of midazolam. So we just want 5 milligrams with 4 mils of saline.
That's so big, I'll drop the next 50.
Yeah, thank you.
Awesome,
Medium
thanks,
big,
guys.
2020.
Let's get all of this ready in case we need it. Right. So at this point in time, we're 20 minutes from hospital, but we've got antidote for TCA. It looks like it's an isolated TCA, so we're not going to rush in and make sure we stabilise everything. And we've got that second crew that we're trying to get that will be able to give us a hand with extrication as well.
Tom's come back and say we haven't got a second crew, sorry.
Is there an, I see a LaRue nearby at all? No one? Okay, that's alright. Alright. And just going to do a quick reassessment of our GCS.
Midazolam.
Open your eyes up for me.
Expires 2020.
With agitate, with pain for stimulant, he does.
Yep, still the same as before GCS of 9.
Inappropriate words,
Localising.
yeah, he moves around. If you annoy him,
Yep.
he'll arc up on you.
Yep, okay.
Yeah, that
Still
100's
maintain that
gone.
airway?
That 100's gone through.
Great. Can I get you to drop another 100?
Certainly.
And at 52 on the core pulse will be when we'll give that.
Sodium bic 8.4.
Right, so we've
Expires
got
November 18.
Sodium bicarbonate 8.4 grams, expires 2020.
Alright, so we're just going to do another blood pressure. And how's that SpO2? Is that improved Plethway wide?
SpO2 is now 93%.
93%? Okay,
Still
good.
bouncing around a little bit.
Yep. So we get another blood pressure. In a minute we'll print off another 12 lead. We'll just give
Okay.
it a minute or two after that sodium
Yeah.
bicarbonate. So guys, our main concern with the TCA is obviously unconsciousness and airway, which we're fixing by having everything ready. Vomit, so be prepared to roll lateral. We'll roll this way so that
Yeah.
all the leads are on that side of the defib. We've got our antidote going in. We're fixing our hypotension with fluids. We've got our legs up and our oxygenation, our ventilation, we're improving with oxygen. That's all things. We've got 5 and 5 midaz. Our next concern is obviously seizure activity. So we're prepared for that as well. Did our blood pressure come back?
Blood pressure comes back and it reads 85 on 40.
And how much of that fluid has gone through?
Well, we're giving you the best part of this bag.
Yeah.
500.
So we'll get
How
another-
much is that?
That's 500, yeah.
That's
We'll
500.
do another bag ready as well.
I'll
Okay.
take that, Jane,
And we'll
thank you.
print off another 12 ready. Right. Okay. We might try, now that he's a bit more settled, to get some nasal CO2 on as well.
Yeah.
Still hyperventilating?
Yes.
Okay.
Got another bag of fluid here,
Awesome.
July
So
19.
July 19.
30.
Great. We can just,
Yeah,
that's all right.
thank you.
So we've got a nasal CO2 that's on the patient.
That agitates him.
Agitates him. Does he tolerate if I leave it for a second and leave him?
No, he grabs that and
Okay.
pulls it out of his nose.
That's right. And we're making sure we take the bottom part of that nasal capnography off. Second 12 lead.
Okay, so you've got a,
Can we just go back to the
Oh, sure, thank you.
And we might get some pads out
Yeah.
and just pop them on as well, just because he is at risk of going into BT.
okay, second 12 lead,
Same.
it's really the same.
Yep.
Yeah, it's really unchanged.
Yeah, great. So we've got 2 more minutes till that sodium bicarbonate's due. We've got it all ready to go. Great, okay. So our blood pressure's starting to trend up with 500 mils, okay? We might draw up 1 in 10,000 of adrenaline, just the paediatric adrenaline, just in case. However, I'm aware that the TCAs have the alpha adrenergic blockade, so adrenaline can sometimes not be successful, but it's just in case we end up deteriorating. So we'll get that ready as well. And we might also, actually no, I don't want to, as much as I'd like to give him on Danstron can have prolonged QT and it's precaution, and he's already prolonged and widening, so we might hold off and just go lateral, and if he starts vomiting, we'll reassess. Awesome.
So I've got adrenaline 1 in 10, 10 to 10.
Adrenaline 1 in 10 expires till 2018. Alright, so that blood pressure's cycling, we've got our pads on, continuously checking our rhythm. Shannon, while we're doing everything and we've got everything ready, do you want to organise extrication?
Yeah.
Just get a scoop and a stretcher for us?
Absolutely.
Okay. We're in Brisbane, are we?
Yeah.
Alright, I'm just going to ask for interest's sake, 505.37. $37 is Haru available.
Haru is in Caboolture.
Okay, that's alright. Alright. So we're just at the 5-minute mark. That ECG is unchanged, so we might push that next 100 of sodium bicarbonate when you've finished with that adrenaline, James.
Yep, no problem.
Okay. Just do another reassessment. Mate, can you open your eyes up for me?
No,
Trap squeeze.
plain, yes.
So same as before. Still maintaining his airway, no snore.
No,
Feel jaw tone.
yes, still okay.
Respiratory rate still tachypnic.
Yes, he is.
Yeah. And feeling for a radial pulse.
Still very
Improved
weak.
from before.
Very weak.
Improved at all.
Hard to determine, but
Okay.
just call it weak.
And that SpO2?
SpO2 bouncing around about that 93% again. 94%.
Yep. Okay. All right. We've given more fluid, so I'll have another listen to his chest.
That second lot of Sodibic was the full 100, wasn't it?
Yes, thank you.
Chest is still clear. He gets agitated with that stethoscope on his
And what's the heart rate at the moment?
heart rate is 120.
120? Okay. All right. Did we find what blood pressure medication, or is it just the aspirin? There's no...
He's on
beta blocker or
aspirin now. They
Cool.
I don't know where his blood pressure medication is.
That's okay. If we can find it, that'd be great, but if we can't, that's okay too. So we're continuing with the fluid. We'll get a third bag up after that to be prepared. And we might draw up another 100 mils of sodium because the last vial is in my kit. And at 57, we'll do a next dose.
Cool.
Alright. So at the moment, our ABCs we're happy with. Our C is our concern, but we've got our legs that we're continuing fluid. These are the effects of the TCA. Our main concern is that sodium channel toxicity. We've considered Haru for an RSI, we can't get them, so our next step's going to be extricating and continuing with management. After this third dose, we'll need to consult for further doses of sodium bicarbonate.
Okay, we'll stop there.
Okay.
Thank you very much.